Today, we're diving into something that many people aren't fully aware of, but could make a significant difference for patients across the UK. And that's clinical home care services. While home care is often associated with supporting the elderly or those needing help with daily activities, clinical home care offers so much more. It brings professional medical treatments, typically provided by hospitals, directly into people's homes. This means that individuals with complex conditions can receive treatments such as chemotherapy, IV therapy, or injections in the comfort and privacy of their own space. So, how does clinical home care work? Essentially, specially trained nurses or healthcare professionals come to the patient's home to provide treatments that would traditionally require a hospital visit. Think of it as taking healthcare out of the hospital and delivering it right to the front door. The benefits are clear. Convenience. No long hospital commutes or waiting times. Comfort. Receiving treatment in familiar surroundings can reduce anxiety for patients. Tailored care. Clinical home care is personalised, allowing healthcare professionals to deliver treatments specific to each patient's needs. And, of course, it's reduced pressure on the NHS. With more people being treated at home, hospital resources are freed up for emergency and acute care. This is a game changer for patients with chronic illnesses or long-term conditions that require ongoing treatment, no doubt. Now, you might be wondering, what kind of treatments can be delivered through clinical home care? The range is frankly impressive, from oncology services like chemotherapy to nutrition support, complex wound care, or even administering long-term medications for conditions like multiple sclerosis or arthritis. Patients who would otherwise spend hours traveling to and from hospital now have a more flexible, patient-centered option. Studies have shown that patients receiving clinical care at home often report high levels of satisfaction and, more importantly, well-being. The ability to be around loved ones, sleep in your own bed, and maintain a sense of normality can significantly improve mental health and recovery times. In fact, some reports suggest that clinical home care services can lead to fewer hospital readmissions and even help patients manage their conditions more effectively over the long term. If you or a loved one feel that they could benefit from clinical home care services, or if you're curious about whether or not it's the right option, there are plenty of resources available to follow. Start off by speaking to your GP or healthcare provider, or check with clinical home care service providers to understand what might be available to you. We've just touched on clinical home care services, but it could be just the thing that will help you and your family. I hope you've enjoyed this care conversation. My name's Gavin Chase, host of the Chasing Care podcast, and I appreciate you being here with me today. Please feel free to subscribe, follow, like, and share It's really important to us. In the meantime, have a great day, and I look forward to seeing you next time.